Hello all, I am Dr. Madhav Rao, consultant cardiac and transplant anesthetist at Apollo Hospital, Jubilee Hills. Today we have eminent cardiac surgeon and transplant surgeon Dr. P.V. Naresh Kumar with us. Today we will discuss about end-stage lung disease and various treatment options available for that. Sir, could you introduce yourself, sir?
Yeah, good morning all. I am Dr. P.V. Naresh Kumar. I am the senior consultant and professor at Apollo Hospitals, Jubilee Hills, Hyderabad, where I do specialize in heart and lung transplantation, and also we specialize in minimal invasive surgery and aortic surgery and also valve repairs. So coming to the topic, what we would like to tell is the situation known as lung failure or end stage lung disease. It happens in certain situations where the patients can be in different age groups. They may be sometimes in a young age group like 20 years, or sometimes in their middle age group like 40 years, or also sometimes in their elderly age group like 60 years, where they have certain situations where they slowly get symptoms of breathlessness, fatigue, or cough, which they take opinions of different physicians and they are being treated with different medicines. Still, they don't get relief. In such situations, then, which is persisting for a long time, they then go to a specialist, maybe pulmonologist, or a person who is more experienced with seeing these type of diseases, where they get to do other tests, and then we can find out at what stage they are.
Having known all these symptoms, whom to consult all these patients, because they will be searching around and they won't be knowing whom to consult and where to go. So what is your advice on this?
So basically what I would like to tell is, if these patients, once they come to know and they have been seeing different general physicians and they are not relieved of their symptoms, they should be consulting a pulmonologist of a reputed hospital or a reputed institute which is near to him. Usually these pulmonologists, they are usually well aware of these conditions. So it comes in diagnosis like 2-3 conditions which are very common. One is called as pulmonary fibrosis, or it is called interstitial lung disease. The other situation is called bronchiectasis, and another diagnosis which can be like COPD or chronic obstructive pulmonary disease, and some rare conditions like sarcoidosis or amyloidosis. So these are the conditions. Once they get diagnosed, then they are put on certain amount of drugs so that their symptoms are controlled. So once they get this situation, such as you can say pulmonary fibrosis or interstitial lung disease, it is a ongoing process. It is something called an autoimmune disease, that the lung tissue is gradually getting destroyed, or it is getting fibrosis. Fibrosis means the lung is normally a very soft or spongy type of tissue. The spongy tissue where the oxygen and carbon dioxide exchange within the blood will be becoming more thick. So when it is becoming thick, the exchange doesn't happen and the patient will be having less and less oxygen for whatever he is breathing. So what happens is, you will get normal persons will, when we see the oxygen saturation, it should be roughly above 90 or 90, above 98 or 96, 97, 98. But in his situation, it will be low. It will be something like 87, 88. So in the initial stages, it may be a little better, but over the time, slowly, they will the saturation will come down and they will be having more and more symptoms like easy fatigability. They cannot walk steps, or if they walk fast, they get breathless. And over the time, like maybe 4 years, 5 years down the lane, doing a regular activity like taking a bath, having food also becomes troublesome for them, or they become very breathless and they are not able to do that.
Okay, sir. What are all the treatment options available for this end stage lung disease?
So now going ahead with the treatment, what we do is once they are being followed up by the pulmonologist, uh, what we see is the pulmonologist puts them on a certain type of medicines which are anti-inflammatory medicines. They try to slow down the process of this fibrosis. So by slowing down the fibrosis, it means that the disease process which would have progressed in 3 or 4 years may take a little more time. We can't say for everyone it will take the same time. It depends on the different disease process, different diagnosis, and like it may take for some 7 years, for some 10 years, or it may take for some even earlier. They may progress to no to a end stage, what we call lung failure stage, early. It can be like within 1 or 2 years. So when we reach this end stage, it means that he is requiring oxygen support intermittently, and over the time it becomes he needs oxygen support frequently. So this is the stage when we should see that he should be no, he should be getting some definitive treatment. Whatever treatment the medicines he was getting till now is only to slow down the process. It is not a treatment option. So once we go for the end stage, or he is going into a worst stage where he is requiring oxygen more and more, we should be thinking of a lung transplantation for him.
Okay, sir. What are all the criteria for this lung transplant? So, whom to consider for this lung transplant? Is there any criteria set up for this?
So lung transplantation, we have different guidelines as laid down by the International Society of Heart and Lung Transplant. So we follow the guidelines, and usually what we do is we don't consider lung transplant in very old people. We consider usually whenever they are less than 60 years, and once they are completely dependent on oxygen, and we know that the disease is fast progressing, and we also see that his other systems are getting affected. Like whenever the lungs are getting fibrosed or they are becoming more stiff, what happens is there is a load on the heart, especially the right side of the heart becomes dysfunctional or it becomes weak, and the pressure inside the arteries, the lung arteries, increases because it has to pump the blood against a high resistance, because the lungs which were earlier soft and like sponge have become like stiff, and when the heart has to pump against such high pressure, they become hypertensive because they become thick. So we have to consider these options of lung transplant before he develops any problem with the heart. And also what happens when the heart starts becoming weak, we start getting other problems, like he can develop kidney failure, and also the liver, because the liver is directly connected to the right side of the heart. There is pooling of blood in the liver and the liver starts dysfunctioning. So at this stage what happens is even the food what he eats, he cannot be digested properly, and he starts getting the nutritional problems. So what we suggest is he should be no, considered for a transplantation before he lands up into any complications.
Okay, sir. What is the outcome of this lung transplantation of late?
So just going to the process of lung transplantation, what I would like to say is how we do this lung transplantation. I think everyone, especially the general public, they know about lung transplantation, especially with the COVID wave which came up to us almost 1.5 years to 2 years ago. The awareness for lung transplantation, more and more people who were suffering from mild interstitial lung disease or who were suffering from other conditions like bronchiectasis and all, they got more aware and they were coming to the hospitals to get themselves checked. Before that, they were, even though they were being diagnosed, they were not aware of it, because as a general all over the world, the COVID has created this awareness, and we even performed during the COVID patients who had severe COVID a few of the cases we performed lung transplantations also. So the process is like, once a patient is diagnosed with end-stage disease and we know that he has to go for lung transplantation at the earliest possible, he has to approach to the transplantation unit, whichever he wants to consult. Like we have at our Apollo hospitals, one of the largest network of hospitals where transplantation is being conducted in almost all of its branches all over the country. And what we do is we register him. We first get him admitted and we see his general condition, general nutrition, and see whether he is suffering from any infections, and do his workup. We do his workup and we see that how is his immunological status, what is his blood group, and we improve his general condition by giving him more nutrition and giving him little more oxygen support and all these supportive measures which we do. And then what we do is we register him once he is clear with all added infections and he is immunized. What we do is we give him vaccinations for all the available viruses and bacteria so that he doesn't develop these infections after the transplantation. And then we register him with our either the National Organ Transplant Organization called NOTO or the state organ transplantation. Now we can register both simultaneously. Once he is registered, he enters into a list of patients who are there waiting as per the blood group. Like there is A group, B group, AB positive, and like that all the groups, we put him into different, whatever his group category. And whenever in our hospital or any hospital across the country, we have a brain dead person, like anyone who is donating his organs after his brain death. Usually they donate the organs like kidney, liver, lung and heart, and we match all his parameters. We match the blood group, we match his immunological parameters, we match his size, and when we get a complete match and we do all the immunological workup, like doing the cross-checking with all the blood groups and all those things, and then we take out the lung, whoever is the donor, we get his lung to our hospital, and when this patient is again anesthetized, he is put for surgery, and we remove his diseased lung and attach the lung of the donor. So this is a process which involves a lot of expertise, like we have a big team of transplant surgeons and transplant anesthetists, transplant coordinators, immunologists, microbiologists, our pulmonologists. All these work in tandem and this process is done. Once this process is done, usually the first 4 or 1 week is a very crucial time where once we have put the other patient, the donor's lung into the recipient's chest, and it is a process because it is a foreign body which has entered into the patient now. The patient's immunological system or his cells or his body will start fighting. That is called, it will try to reject. So in that situation, what we do is our immunologists and all get into the job and we give immunosuppressants and we start stabilizing the patient. And usually most of the time, once after the immunosuppressants and all take their action, the lung is accepted, and then maybe within a week or so he can be almost out of oxygen and he can be shifted to the ward, and we do his physiotherapy and then slowly get him out of the bed and out of the hospital. So one more point which is very important, I would stress for all our patients or whoever our referring consultants, pulmonologists who are having their patients in their OPD or looking them after them, is we should refer these lung transplant patients or patients who are suffering from lung failure at an early stage. Why we want to refer them at early stage is because we have seen over the years that the outcomes are like almost 75 to 80% success rate when they come at the early stage. If they are coming at a late stage when they are too much dependent on oxygen, or they have become very weak because for 2 or 3 years they have not had sufficient nutrition, or they are suffering from a lot of infections, because once the lungs have become gone into failure, they tend to get a lot of infections. We cannot have a good result out of the transplant. So the early they come, they quickly recover and they have a prolonged life and also event-free life post-transplant. Thank you.
Thank you, sir, for sparing your valuable time and sharing your advice with all of us. If you have any queries regarding this topic, please follow the description given below. Thank you.
Okay, thank you.